The coronavirus pandemic had a profound effect on how we all lived our lives.
Hospitals at capacity, businesses closing.
People out of work, shelter-in-place orders, full lockdowns.
Kids falling behind in classrooms, struggling with remote learning. The workforce transitioning to remote work.
And after 3 long years, the government is ending the public health emergency declaration. Just last Friday, in fact, the World Health Organization announced COVID-19 is no longer an international concern.
Over 7.5 million lives lost, more than 1 million in the United States alone.
Here's a look back at how this pandemic unfolded.
December 2019, a cluster of people started experiencing pneumonia-like symptoms in Wuhan, China.
January 2020, the World Health Organization begins calling the disease 2019 novel coronavirus.
January 20th, the CDC confirms the first case in the United States in Washington State. January 23rd, Wuhan, China, a city of over 11 million people on lockdown.
January 26th, the first case in California is recorded. In February and March, 2 cruise ships were quarantined out in the water, barring anyone from leaving the ship. March 6th, the Fresno County Department of Public Health confirms the first case in Fresno County.
March 11th, the World Health Organization declares COVID-19 a pandemic. March 15th, states start to implement shutdowns. New York City, the nation's largest school system, shuts down.
March 19th, Governor Newsom issues a statewide stay-at-home order. People could only leave home when necessary.
All but essential business shut down. March 27th, the Trump administration signs the CARES Act. That includes funding to issue $1,200 checks to every adult. May 9th, the unemployment rate reaches 14.7%, the highest since the Great Depression.
May 28th, the death toll in the United States surpasses 100,000. October 2nd, President Trump tests positive for COVID-19 and is treated at Walter Reed National Military Medical Center.
December, the vaccine starts to roll out. America's death toll surpasses 300,000. Over 1 million are dead worldwide. Now into 2021, more than 400,000 dead in America from the virus. New variants start to emerge.
Over 100 million cases recorded worldwide. More than 23 million Americans have been vaccinated against the virus. Mask mandates and social distancing are still in place.
By the end of February 2021, the COVID-19 death toll surpasses 500,000 in America. An estimated 4 million people have left the workforce since the start of the pandemic.
Fast forward a year now, March 2022. Vaccines are now approved for children. The Omicron variant is running rampant, accounting for nearly all new cases recorded in the U.S. The death toll is now nearing 1 million. Nearly 80 million total reported cases in the U.S. since the start of the pandemic.
For the second year in a row, COVID-19 was the third leading cause of death behind heart disease and cancer. Bivalent boosters are developed and encouraged for many.
Today, the CDC reports over 1 million deaths. That's about 980 people every day since the start of the pandemic. And while many are ready for this chapter in our history to be over, the reality is that COVID is not over.
The agency reports in the last week there have been over 1,000 COVID-related deaths. Less than 17% of Americans are fully vaccinated against the virus, with about 77,000 new cases reported last week. Now, with the public health emergency ending, the CDC will no longer be able to collect certain data which will change the way it reports coronavirus trends and information. Vaccination requirements will end for many, including travelers into the United States.
Access to health care coverage may end for many. Some may then now be paying for COVID tests, both at home and at the doctor's office.
Antiviral treatments like Paxlovid will remain free until the national supply runs out. After that, most people will likely be charged. Vaccinations will likely remain free for most people through Medicare, Medicaid, or private insurance.
Yeah, we talk about the shutdown. We still came to work. We were considered essential workers, and we had to carry something in our car from the CDC to prove if we were pulled over, as to why we were out on the road, why we were.
Just reading that recount of what we lived through, I don't know about you. I immediately was there. I was
bawling.
Yeah.
I could not get through everything. I still feel very
understandable.
Emotional.